We're diving into a crucial diagnostic tool in immunology and hematology, the CD20 test via immunophenotyping by flow cytometry. Whether you're a student, a healthcare professional, or just someone interested in how we diagnose and monitor various conditions, you're in the right place. So, let's get started. Pre-test information. First up, let's talk about what you need to know before the test. Before performing the CD20 test, it's essential to provide a brief clinical history. This helps in interpreting the results in the right context, considering any underlying conditions or recent treatments that might impact the test outcomes. Specification of test. Now, onto the specifics of the test. The CD20 test is a type of immunophenotyping done through flow cytometry. This technique allows us to analyze the expression of the CD20 antigen on B cells. The CD20 test is particularly useful in monitoring therapeutic B cell depletion. It's critical in managing malignancies like B cell leukemias and lymphomas, as well as autoimmune diseases such as systemic lupus erythematosus, SLE. It also plays a role in the treatment or prevention of acute humoral rejection in renal transplant recipients who have a positive crossmatch. Specimen used. Moving on, what specimens are needed for this test? The specimen used for the CD20 test is typically a blood sample. This sample is processed to isolate the cells needed for analysis. Components included. Let's break down the components included in the test. The CD20 test involves specific antibodies that bind to the CD20 antigen on B cells. The flow cytometer then measures the fluorescence emitted from these antibody-antigen interactions to quantify the number of B cells present. Test report time. One of the great things about the CD20 test is its efficiency. You can expect to receive the test report on the same day, which helps in making timely clinical decisions. Test information. In summary, the CD20 test is a vital tool in both diagnosis and monitoring. CD20 is a pan-B cell marker used to assess B cell depletion in various clinical scenarios, including malignancies, autoimmune disorders, and transplant rejection. It also helps confirm the absence of B cells in cases of suspected primary humoral immunodeficiencies. Anti-CD20 therapies, like Rituximab, are often employed based on these test results to treat conditions such as B cell leukemias, lymphomas, and other immune disorders.